you have knee pain, the key to the knee is these two muscles behind the knee, is the Popliteus and the Plantaris muscles. So the Popliteus muscles go kind of like from midline out to here, and the Plantaris muscle kind of goes from your heel, but it's a strand, a tendon, but the muscle comes out to here. So from like there to here. So it's behind your knee. So they're short muscles, but when they're tight, short muscles are strong, and they clamp down and they actually compress your knee. And that's the key to the knee, meaning if you have knee pain, knee compression pain, is probably due to those muscles. You can start like this, and go this way, back here, and you can go down here. That's the Popliteus muscle here. Plantaris muscle out here. Use the weight of your leg to drop down. And having the weight of your leg, you can actually drop all your weight down there. And then you can just kind of guide your leg on there this way. Or you can start moving the gun around like that. That's how you can get a little deeper. Same with your calves. You can actually remember how you can just drop your leg there. But now you're doing the Popliteus muscle in the back of your knee. And then out on this side, the Plantaris muscle, right there. There's another one, the Sartorius muscle. This muscle comes from your hip, wraps around, past your knee in the mid side. So we're gonna actually keep our leg on the bench in this fashion and start from here. So it's from here. I'm just gonna show you to about here. But again, we're gonna do cross pattern. I'm gonna find the knot. Another way to use different type of tools or anything, you can use a bottle, you can use your phone, like the corner of your phone. I had to use that one time when I was snowboarding and I had nothing else to do and I was in my car and my knee was hurting. So I used the corner of my phone, but basically for your knee, like the Popliteus and Plantaris, if you don't have a lacrosse ball or if you don't want to use your fingers, you can use anything like this and then just kind of lean your leg onto that and like just kind of like smash it this way. So you have that point right there. If that's too pointy, use the other side. You can do that. You can kind of get into your Popliteus Plantaris this way. On the other side. If you have a tool, you can use that, which is a little bit sharper. Do that on the back on the Popliteus. Oh, you can actually see it. It's a little sore. Very effective. Dang. So try that. All right, so now the Sartorius muscle with the lacrosse ball. So Sartorius crosses your knee, wraps under the VMO, and then comes to your hip as a part of your hip flexor. So you can just use your lacrosse ball with your hand pressure. And it's usually tender. If you have Sartorius issues, it's usually tender from your knee to right about mid-thigh. And then you kind of lose it because it's not as prominent or tender all the way up to your hip flexor. So this is where you would focus on, especially if it's affecting your knee. And then another way to do it with your elbow. It's my preferred method. You just get your elbow, same as if you would do your quads. You just get in there. Yeah, so that's a good one. I would rather use that one. Try that one.